casualties of America's broken healthcare system continue to pile up.
You know, I had to do what no parent should have to do, and that's have your daughter die in your arms. And you can't save her, there's nothing you can do. And I remember crying out to God to please take me instead. When I found out what had happened and realized the magnitude, and it wasn't just Shalyn, but there were other Americans that are, you know, losing their life, or they're navigating a serious illness without any means of paying for it, or they're worrying about that instead of worrying about getting better. I knew I couldn't stand by. I could not remain silent. I had to speak up, and I had to fight to ensure that this doesn't continue on. And that's how I got involved in fighting for Medicare for All.
And create advocates for change, like Amy and David Villela, who we met at the 2017 People's Summit in Chicago, which brought together voices who are demanding universal access to health care and prescription drugs, at a conference organized by National Nurses United, one of the first unions to endorse Bernie Sanders' presidential campaign. They've also advocated for universal health care on a national and statewide level.
In Nevada, since we started working, trying to do healthcare rallies, and then we organized a couple of healthcare rallies, forming coalitions of different groups. So since then, we got one of our Congresswoman Dina Titus, she co-sponsored HR 676, Medicare for All. Now we're trying to put pressure on our representative, Representative Ruben Kuhn. He's actually on the Progressive Caucus, but he is not co-sponsored HR 676. We're trying to pressure him to do it, and he's giving reasons. I can't do it because we are focusing on protecting the ACA. But we can do both.
The Villellas say they have joined a growing local movement in Nevada to push their elected officials to support single-payer health care.
The weaknesses of the ACA, and he's saying, look, it raised premiums for people, which is true.
Right. So the ACA, some of the things accusations makes are correct, and that's where it's gaining power. In that the ACA was torn apart even before it began, when they didn't do Medicaid expansion. For instance, Shalyn was from a state that did not do Medicaid expansion. They took out a lot of the safety nets that would have caused less people to be uninsured. There's 30 million without insurance right now. But their claim that the AHCA is the answer to what's happening with the ACA is disingenuous. It's not correct, and it's only going to make it substantially worse. The Democrats we need to fight, and I'm fighting as myself. I fight for the ACA, but we need to have on our platform that we are going to move forward and push for Medicare for All. That should be on their platform.
Meanwhile, in California, a measure that would establish single-payer health care there has stalled in the Capitol after passing the Senate with overwhelming support. We caught up with Catherine Kennedy, a registered nurse and a board member for the California Nurses Association.
Really, it is about which side are they on? Are they with the hospital industry, the pharmaceutical industry, or are they on the side of the people? Where really we need to make sure that every human being has health care. And so one of the things that we've done is that there's a financial study that came out from the University of Mass, which really shows that in California we can do it. It'll be a savings of over $37 billion every year. So it can be done. We're already paying into a system right now, and they just need to have the guts to pass this.
Also speaking at the summit were advocates for access to affordable medicine internationally, including in the United States.
Right now, access to affordable prescription drugs is a #1 health concern among Americans. And everybody knows that Americans pay the highest prices for medicines than any other country. But I can tell you, as someone that works on this issue internationally all over the world, that this is actually a challenge everywhere. In the world's poorest countries, but also in many of the world's wealthiest countries with single-payer, Medicare for all, universal healthcare systems. And that's because medicine prices just keep getting higher and higher. We have cancer treatments that are hitting the market with 6-figure price tags. We had the latest scandal around the EpiPen. Insulin prices are skyrocketing, and the list goes on. And Right now, it's interesting because all over the world, since it's a problem everywhere, you have governments really grappling with this and trying to figure out what the right solutions are. So we have an opportunity to demand real change around this issue. Because the public is already doing so much of the most important medical research and development, what we could do is basically do research and development in a totally different way, in a not-for-profit way. And since I work internationally, I'm telling you, we have examples in not-for-profit drug development for disease areas that the pharmaceutical industry has deemed not profitable. So it's diseases of the developing world and of the poor. And we have these models. We know how to do it in a way so we pay for all of the research and development up front, so that when that medicine becomes available, it's available off patent and it's available in generic form and available to everyone. But this is not a technical problem. We have all of the technical solutions. It's a political issue, and it's about power. And really, the pharmaceutical industry has captured so much of that power, and we need to reclaim it back.
Advocates say Big Pharma's grip on politics needs to be challenged just as much as the healthcare industries. For all of the Real News coverage from the 2017 People's Summit, go to therealnews.com. With Michael Sinato, this is Jessel Noor in Chicago.